How to use the massage gun for shoulder pain. There are a lot of muscles that attach directly to the shoulder and indirectly.
Right.
And they all can affect the position of the shoulder. The first ones we're going to talk about is the pectoralis major and minor here. You can see them.
Right there, those chest muscles.
Right. So here's the major, and underneath it is the minor. Now the major, it attaches right to the bone of the shoulder, the humerus.
Humerus, yep.
And it can actually turn that muscle in if it's
Now
the pec minor actually attaches to the scapula.
Yeah.
So they can actually cause the scapula to be depressed. The latissimus dorsi also attaches to the humerus and also can internally rotate. Now for the chest muscle, because there are ribs right underneath it, you're probably going to want to use a flatter head,
Yep.
or maybe the air-filled head. And yeah, you can feel it. I mean, obviously you can hear on my voice too, but I mean, the ribs are right underneath there.
Yeah. So yeah, because when I do mine, I go at this direction, just like this, and that
Yeah,
works.
you're definitely headed across then.
Yeah, and there's quite a muscle belly at that point, so you can, I use the bigger gun with this, and it works well.
I'm going to hit the latissimus. A little bit difficult to hit yourself.
Yeah.
You might have to have somebody help you. Now this muscle, you could, there's ribs there too. You're going to hit, if you get too aggressive with a point.
But no, yeah, it's a little bit of a reach, but
yeah,
it's
and that's
doable.
where you might need somebody to give a helping hand.
Yeah.
It's a shoulder blade, but you can see how it attaches right to the shoulder. So if this is not stable, or if it's depressed, or if it's rotated, that's all a problem for your shoulder.
Trapezius.
Upper trapezius, middle trapezius,
Had me
lower
going
trapezius.
there.
Yep.
Yeah.
So over here is the rhomboids.
They're underneath the
Yep.
trapezius.
And here's the levator scapula. And that goes right up and it attaches into the skull and the neck here.
Now I'm going to put the ball head on there because the ball, you don't have to go straight in with an
Right,
airhead.
you can get an angle on it.
Yeah,
then.
and that works pretty good. So I'm going to work that here. You don't want to massage with the gun over a bone.
Right.
Ooh. Actually, I can get pretty far down there, Bob. I'm kind of amazed.
How about the rotator cuff itself? This is coming from the back here. So Brad, yeah, right there. So we're looking at the muscles of the shoulder blade. The top one here, that's the supraspinatus. Then we got infraspinatus, and then we got teres minor. Oops, teres minor and teres major. But these three are part of the rotator cuff.
Sure.
And if you look underneath the scapula, which you can't, on the other side,
Yeah,
inside your body.
It's between the scapula
Yeah.
and the rib cage.
You have the subscapularis, so we're not going to be able to massage that one, but you certainly can massage the. So I'm going to hit right above it to start off with.
So that's the muscle that you get your impingement on the tendon, which is over. But that's a good reason to massage
There's also
that.
tendon right. This is a good one to use the airhead because the bone is right there. The last one is the deltoid muscle.
So that's the superficial one, and that's the more meaty one. That's the one that gives power to that shoulder.
Certainly, when you can really.
Getting to the back one's a little harder, but you can still do it. There.
The recommendations we made for the heads are probably fairly good. Like the deltoid, you could probably even use a pointer because it's a pretty heavy muscle.
Probably fairly good. I think they're outstanding.
There we go.